Being a dentist, my first thing that I look into that person is the teeth. Somehow I might just go to the teeth first. And I feel like it's important to understand that beauty is just not tied up with aesthetic, it's tied up with function.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Mayank Kakkar, an internationally trained dentist and implant-focused clinician dedicated to transforming smiles and restoring confidence through full mouth rehabilitation. After earning his dental degree in India, he advanced his training in the US with a master's in healthcare administration and an AEGD residency at the renowned Eastman Institute for Oral Health. He also completed a fellowship in special needs dentistry, reflecting his passion for caring for medically complex and underserved patients. Today, he practices at Richmond Dental Dentures and Implants, where he combines advanced implant techniques with a compassionate, patient-first approach. So, Dr. Kakkar, welcome and glad to have you here.
Thank you so much for the kind introduction, Daniel. I'm happy to be here today.
Yeah, so let's start from the very beginning, Dr. Kakkar. What got you first interested in the medical field?
Yeah, that's a great question. So back in India, while I was growing up, I was in the school, and actually I used to play soccer quite a lot. And I had a friend who actually got hit by the cleat, and I have seen that at my first-hand experience, and we had to rush him to a hospital, and then eventually like his front two teeth were knocked out, and so the kind of transformation that I've seen it while I was growing up, it just created a huge impact on me that dentistry plays such an important role, not only just with the teeth, but actually overall confidence, overall, health. It has a lot of impact on your systematic health. So I just felt like this is something I want to do it, and you can see the instant transformation. That's a big thing about dentistry, that you can literally see the results in like 1 hour. It's a whole different person when someone walks in and when they walk out of the office.
Mm-hmm. Okay. And did you know from that early age that you wanted to go into dentistry, or did you just know you wanted to get into medicine and then dentistry kind of became the focus later on through life?
Yeah. So I think that kind of like opened the door for me for being in the healthcare profession. I was still trying to understand how do I take it forward from here. So that helped me to get into the healthcare profession. But eventually, when I was applying to my med school back in India and dental school, and when I had to make a decision, then I decided to go with the dentistry field.
Okay, got it. And so what led you now to where you are, Richmond Dentures and Implants? Tell me about that journey.
Sure. So after I moved to US, I actually went to business school in Texas. I went to University of Houston in Clear Lake, and I did a master's in healthcare administration. And the reason I joined that because I wanted to learn little bit more about the healthcare system of US. I wanted to understand about the business side of it. It's completely different from how it's back in India and here. So I think it definitely helped me a lot to have a different viewpoint about the healthcare system and insurances and the whole field. And meanwhile, I was still trying to make my way up to get into my residency over here. So I was constantly applying to different dental programs. And then later on, I was fortunate enough to get accepted at University of Rochester, where I did my AHD residency and followed by the fellowship as well. From there on, I graduated. I started working in different places. I was a general dentist. I'm still a general dentist. But I wasn't sure about how I want to take my career from general dentistry to more specific kind of option or treatment. After doing the general dentistry for about 1 or 2 years, I was really passionate about implants. I was already placing implants, but not to the full capacity. The more I learned about the implants, the more I was seeing the transformations. I knew it after that. Okay, this is what I want to just focus on. I don't want to do anything else. I just want to be completely 100% devote myself to implant industry, and that's how I started working towards it. And today I'm very fortunate to be working at Richmond Dentures Implants from last 1 year, and we have been doing all I do every day is implants. That's all I do. So I love it here. I am absolutely passionate about this. This is huge because the kind of patient that comes to my practice are the patients who are looking like a second chance in their life. They are their teeth are broken. They have been to different dentists. They have tried to do a lot of things, but now they are to the point where nothing. There are not much options, and it's just amazing when I see or hear their stories, and how just having those full mouth rehabilitation can impact their life, where they're able to go back to their dating life, they're able to go back to their daughter's wedding, or they're able to go for a new job, and most of them are working in a public place. They're able to connect with the people much more better, and they are succeeding in their life. So I just feel like I'm very, very grateful for having this opportunity. I'm founding my passion where I dedicate myself just for implant industry.
Okay. And I mean, your background is a bit unique. You've practiced in two different countries. You also have the background in healthcare administration. How would you say that that background has changed how you view patient care?
Yeah, that's a great question. So I think uh, working in two different countries, or having experience from India and then coming to US, definitely I've found a lot of differences, and I've also found some common grounds. The common grounds is like people are people. They all want to get back to normal health. Everyone wants to have a better smile, better confidence. So just understanding that they are not just a number, but they are. I'm not treating just a teeth or oral health. I'm actually treating a person. So I've changed my perspective a lot, where I'm now more focused on person first, and then diving into the oral health. So I think that I've learned a lot. And having a business background or business degree, dentistry in US is very different. Actually, it's that's the reason we call it as a dental office here and not like dental clinic. It took me a time to understand why it's not dental clinic, why we don't just call it dental clinic. It's why we call it dental office. And the reason is it is the office. It is the people, where it's operational and finance and IT and technology. There's so many aspect, marketing, HR, so many different aspect of it, that you run this like a proper healthcare facility, with a business aspect to it. I think getting that knowledge has helped me a lot. It has After I graduated from my master's, I actually worked for one of a company as a regional manager. So I had a opportunity to manage a couple of offices at time, and that experience has been phenomenal for me. I think a lot of my success credit goes to that experience, because I've learned so much in that. Because I'm able to connect with the people more, because I understand the background a little bit more than just about the industry part. So I think I would definitely recommend everyone to go and shadow and observe the business side of thing too, because you understand that it takes a lot of effort to bring the patient right on your dental chair. There's so much things goes behind the scene, connecting with the patient, doing the marketing, making sure that they're landing on the right page before I get a chance to actually work on them. So I think I'm very blessed that I took that route, and I happened to go to business school and get that experience. But I think that's definitely very different, because not many dentists does that part. And
Mm.
I've even seen it multiple times that in the future, when people have their own office, or they're opening their own business, or even if you're running a dental office and you are the leader of that office, if you don't really understand the overall job of every single person, and you're just focusing on your own clinical part, then all the team members are not in the same page. And we want to make sure that we all on the same page. We all are respect to the other people's work. And in order for me to do that, I need to know what they're doing it. And the way I was able to understand that is because I was in their shoes. It's easy for me to connect to the front desk or office manager, because I like, hey, I understand you had a bad day, because you are doing a lot of things which probably nobody recognizes it too much, but I know it's a lot to take in.
Okay. So now that you're working in this practice, I want to dive into some of the treatments that you provide. Let's start with the All on X. What is the All on X for people who have no idea what it is, never heard of it before?
Sure. So Olonex is essentially a treatment where we are trying to get someone back to a life with the help of dental implants. It is not a treatment to replace your existing teeth if they're healthy. This is not a cosmetic treatment, it's more of a surgical treatment. And the reason I'm sharing this, because the idea is not that, hey, I'm frustrated with dentistry and I don't like the dentist, and I'm just not, I just don't want to be keep going to a dental place, and I just want to get everything teeth to be out. That's not what we are trying to focus on. What we are trying to focus on, what can we do to bring you back to the closest to your natural teeth when everything is falling apart in your mouth. So with the help of Olonex, what happens is we take out all the teeth. If they have some remaining teeth or infected teeth, we take out all that. We take out all the infections, and then we place anywhere between 4 to 6 implants, sometimes seven or more, depending upon case to case. And then we put those implants in a certain position, certain depending on anatomical landmarks, and then we restore your aesthetic and function. More importantly, to make sure you're able to chew and eat much better. It is a complete transformation because you're able to eat much better, you're able to chew much better, and it's giving you the best aesthetic smile that you were always dreaming about.
Mm. Now, when it comes to the All On X versus things like dentures, is it kind of one in the same? Are they vastly different? Is like the All On X kind of an upgrade from dentures? Like, what's the relationship there between the two?
Holonex is 100% the best treatment. I truly believe in that. I have my father who has Holonex on his lower teeth. He was in denture for a very long time. Denture is essentially a removal appliances. It's going to stay in your mouth, but it's not being anchored with something. So after every meal, the food might go inside it. You have to take it out before the night time. Yeah, it rocks because when we lose the teeth, we lose the bone. And now that we are putting a denture or plastic piece inside the mouth, which is going to be helping you to eat and chew better every day, but you're also putting a pressure on the bone every day, and it's over the period of time, it's going to keep resorbing it. And that denture is going to become loose, and you will be back again where the denture is loose, the food is getting underneath it, you have to take it out, you end up public or anywhere where you're talking and the denture might fall out. So Olonex is a whole different thing. It's a fixed teeth which is going to be secured. It never comes out. Only the dentist can take it out if they want for some reasons, but it is fixed. So you can eat anything what you would like with that. You don't have to take it out. You just maintain it as just the way you have your natural teeth. So it is definitely a hundred times better than denture. If the bone allows, if you have enough amount of bone and other parameters is what is within the limits, definitely Holonex is a way to go.
Okay. And with this procedure, the All On X, is that something that's done in one sitting and do you need to come back kind of multiple times to get everything done completely? Like, what's the timeline process that it looks like?
Yeah, that's a great question. So there are different ways to do this. The way I do it is where you get the teeth, all the surgeries taken care of the same appointment. Let's say we are doing the top and bottom, upper jaw and lower jaw at the same time. So we take out the teeth on the upper, lower. We take out all the infection, level the bone, put the implants on upper and lower, and then you get the temporary teeth on the same day. So you do walk out with the teeth on the same day. They're not the final teeth yet; they are the temporary teeth. And the reason why I prefer this way because now you have an opportunity to look and try those teeth. Let's say you try it for a couple of days. You're like, you know what, doc, I don't like the size of the teeth. I want to change the size of the teeth. I want to make it a little bit more bigger or smaller. Or I don't like the bite. I feel like I'm not able to chew much better on the right side, but I like it the left side. So it gives me an opportunity to keep manipulating the teeth and customize it to the patient's need and within the normal parameters. And we have to wait for a few months till the implants heal. Just imagine like putting a nail in the wall. You want to make sure that wall is strong and you want to make sure the nail is actually anchored in the wall very strongly before you try to hang any kind of thing on top of it. So because the temporary teeth are a little bit softer, they're putting a less pressure on your jaw. You're getting used to it with the new teeth as well. Your tongue, your lips, your cheeks are getting used to it with the teeth. And when all the implants are healed, and that time we go ahead and replace that with the final teeth, which is made of zirconia.
Okay.
And that's how we finish all the treatment in like 4 to 5 months.
Wow. Okay. And then after that, once they're done with everything, is it going to last kind of the rest of their lives? Is it a certain time frame of how long it's going to last for?
Absolutely. So the goal is always we want to make sure that this lasts for the rest of the life. That is the mindset. That's the number one thing I'm keeping in my mind when I'm going and working on someone's mouth. That hey, I want to make sure I can give them something which lasts for essentially forever. Does that happen all the time? No. The reason why because there's a lot of things that happens once uh, you go out of your life, you start using them, and if you still don't maintain them or we don't keep it clean, the bacteria can still get in just the way that you had the issues initially. Just think in a way, I always tell the patient that we have to do this because there was something wrong with your original teeth. If the original teeth were great, we never have to be at this point where we have to do this. Now we have to do this because something was wrong with your other teeth. So we want to make sure that we are not repeating the same mistake. We are making sure that we are seeing the dentist every 6 months, making sure we are keeping it clean. Just like buying the car, right? We want to make sure the tires are getting changed. We are changing the oil, like all those kind of stuff. But as long as you maintain them, they essentially last forever. Yes.
Okay. Now, what would you say some of the most common misconceptions or myths that you hear from your patients about the all-on X?
I think the some of the misconception is I feel like many times we feel like that there is not enough bone, or we feel like maybe this option is not there for me. I think I've come across a lot of people where just the education part was not there. I think they were not completely informed about the true picture. There's always a way to figure it out. There are a lot of advanced implants. There are different technologies that there may be something that I might not be able to do it, but there can be a different surgeon who's better skill or who uses advanced skill sets. They're able to do it. So I think denture is a very old way of restoring someone's mouth, and now there's much better options. You're actually able to use those teeth, not like a denture which is mainly for aesthetics, especially the lower ones, because when we eat, it's the lower denture that keeps moving, the tongues keep pushing the lower denture out. But with implants, they stays fit, so they're actually functional. And a lot of misconceptions also that it's just my mouth, it's just one tooth, it's just a couple of teeth. How big difference is that? Actually everything starts from your mouth. If you're not able to eat and chew much better, your overall health get affected by that. There are a lot of people who have huge infections, and their blood pressure is rising, or their diabetes is under control. It's not under control. So there's a lot of things, systematic issue that happens because of the oral health. So we need to think of a bigger picture and not just think about that it is just few teeth and I can live with it. So I think that's very important to education part is very important.
Okay. Now, if someone is looking to get the all-on X done and they don't know who to go to, what advice would you give to this person as they do their search that they can find a dentist who has experience, has a knowledge, and can get them a great result at the end?
So I think the best way is obviously we all start from Google, good old Google. But I would say like make sure that you get a couple of consults. I think this is important. Not Don't just get stuck with one person. Get a couple of options. Try to speak with many dentists so that you can actually understand. As we talk to multiple people, you start to gather more and more information, and knowledge is power, right? So the more we gather the information, the more we are able to connect with someone. Personally, I say that, and this might go a little bit in a different directions. Some people may have a different opinion about this. I feel it's important to understand that implant dentistry is not a surgical dentistry. It's a prosthetic dentistry. And what I mean by that, patients comes to me for their teeth. They don't come for the implants. At the end of the day, you don't want to be in a situation where the implants were placed in a different direction and now we are trying to make it work some around those implants and give you the teeth. It should be the other way around. We should have the final goal in our mind and go in a backward direction. So the reason I'm saying this is you want to make sure you are working with a team who are collaborative. You're working in with the people who are thinking about the final outcome first, and then trying to figure out how to achieve that goal. And it's usually the other way around. We rush into getting the implants, we rush into getting the teeth out. Now we don't have the final picture in front of you, and we are trying to make it work. So I think these are some of the things that I would definitely keep in mind when you're looking for an implant dentist.
Got it. And when it comes to the future, Dr. Kakar, where do you think the future of dentistry is going?
Yeah, so the future of dentistry is definitely getting more towards technology, and I think that's great because with the help of technology, you're able to really visualize and understand the final outcome. You're able to have much more precise outcome, no guessing work. Like with the help of CBCT, now you can actually analysis everything in 3D instead of 2D image, so you can see everything from the front, back, sides in all different views. With the help of 3D printed, which we use it every day in my office for the temporary teeth, with the help of that 3D printer, I can give them something right away. If someone fractures their teeth and they come into my office that, hey dog, you gave me a temporary teeth, it got fractured, and I cannot really go out and eat something right away, I can literally print it out my printer and it will take only like 1 hour for me to do everything. versus where I used to rely on the lab and I'm sending it to the lab and lab is shifting it from California. It's going to take a few days. I think with the technology, I'm able to really expedite these things much better, and also it gives me an opportunity to actually customize the things a lot more different way. I can try different sets of teeth because I have a 3D printer. The another thing is like with the facial scanners you can actually build a virtual patient. So not only I'm just seeing the oral health or mouth and everything, I can actually visualize their face, their eyes, their nose. I can look their midline. I can really connect with that person, and even the lab who's working in the back end is able to understand that, okay, I'm working for this particular person who looks like that, you know, versus where they were just focusing on teeth. So technology has definitely played a very important role. It is going to keep on evolving, and we need to evolve along with it for sure. Um, it is at the end of the day going to be brain guided surgery. We need that human hands for sure and human brain for sure. We need to give the direction to all the technology and machines. I don't think so we'll ever be able to replace it, but with the help of technology, things are definitely getting in a much more precise and much more accurate, and that's what we want for a patient. We want to make sure we are able to give them something which is predictable, which is precise, which is accurate, and we are repeatable. I think it's very important that things, whatever workflow, whatever thing that we are doing it, we're able to repeat it consistently in everyone. Not like hit and miss, and like, hey, it worked in that person but it might not work in that person. It's predictable. So technology is definitely very, very important.
Got it. Well, sounds like an exciting future ahead. Now, Dr. Kakkar, I do have one last question for you, but before I ask it, I do want to point people to your website at richmonddentures.com. Now, last question for you. What does beauty mean to you?
So that's a wonderful, wonderful question. And I was thinking about that from quite some time. What is beauty, right? So I think for me, being a dentist, my first thing that I look into that person is the teeth. Somehow I might just go to the teeth first. And I feel like it's important to understand that beauty is just not tied up with aesthetic, it's tied up with function. For me, when patients comes in and they tell me that, hey, I want the teeth which is the best looking teeth, and I tell them I will give you the best looking teeth, but I think my goal for you is to make sure I can give you the teeth which is not only looking beautiful, but it's actually functional. You are able to actually utilize them. For me, the beauty means that we are able to provide something which is, we are able to see overall things, not just the aesthetic component for it, but actually we are able to see much more deeper into it. And I think that's probably right to say that, beauty lies in the eyes that the person sees it, right? So I think it's important to understand the overall perspective and not just the outer beauty of it.
Okay, well, there you have it. Dr. Kakkar sharing his expertise. So, Doctor, where can people contact you and your practice?
So you can definitely look up into our website, richmonddentures.com. We are located in Richmond, Virginia. You will be able to contact us through that. We also have a phone number, which is 804-977-6520.
Okay, awesome. Well, Dr. Kakkar, this is great. Thank you for coming on. Thank you for sharing your knowledge, and thanks for sharing your message.
Of course, thank you so much for having me in. I appreciate you taking time to speak with me today.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.